let me introduce myself. I'm Dr. Stephanie Denaire. I am a Nebraska chiropractic physician. I want to talk to you a little bit today about thyroid, hormones, and women. We're going to talk first about the symptoms of hypothyroidism. That means a thyroid that isn't working as it should. First of all, you're going to feel a lot of fatigue, tired, sluggish. Do you have cold feet or cold hands? Do you require excessive amounts of sleep to function? Do you gain weight easily? Do you have difficult or infrequent bowel movements? Are you depressed? Do you suffer from depression? Do you have a lack of motivation, not being able to get going? Do you suffer from morning headaches that wear off as the day progresses? Do you suffer from thinning hair or excessive hair falling out? Do you suffer from dryness of the skin and or scalp? And do you suffer from mental sluggishness? Do you go into the next room and forget what you're doing in there? Even though you could be on medication, Synthroid, some of those others that are out there, but you still have these symptoms, that total thyroid issue is not being addressed. The other side of a thyroid issue can be hyperthyroidism. Those people who have heart palpitations, inward trembling. Do you have an increased pulse even at rest? Are you nervous, emotional? Do you suffer from insomnia? Do you suffer from night sweats? And do you have difficulty gaining weight? Sometimes there are people out there who have what we call Hashimoto's disorder. It is an autoimmune disorder, which the patient's immune system is attacking the thyroid. Patients that suffer from Hashimoto's have all of the symptoms. Let me tell you how we can finally end your chronic health condition nightmare. Right now we're talking about the thyroid. What makes us different is that we treat patients metabolically and neurologically. No stone is left unturned to determine the exact cause of your chronic condition. Right now, thyroid. We're going to do specific blood tests. Definitely we're going to do a thyroid panel. We're going to do a complete metabolic panel. We're going to do a lipid panel. We're going to do blood tests. We're going to test everything. By doing this, we're going to be able to assess your thyroid. We're going to assess your adrenal glands, your kidneys, your red and white blood cells, your gut function, and we're going to be able to do that with these tests. We're also going to do some sensitivity treatments and testing. To do that, we're going to do stool sample. We're going to test to see whether you have gluten sensitivity. We're going to test to see if you have sensitivity to the casein, which is the peptide in milk. We're going to test and see if you have a sensitivity to eggs, to soy. Some of the symptoms that come along with those sensitivities could be chronic pain and fatigue, frequent indigestion, but again, we can have that along with the thyroid. All of those things work together and can be causing the symptoms that you have. Sometimes you have frequent or loose bowel movements. Constipation, you can have one or the other or alternating. Mouth ulcers and sores, and maybe vomiting often. And the only way to be able to find this is to do the testing, see if you have those sensitivities. The other thing that we'll examine is your adrenal stress index. You've heard of the adrenal gland kicking out cortisol. That adrenal gland sits right above the kidney. It kicks out that cortisol. That cortisol can affect your sleep habits if you're not able to go to sleep or if you have trouble staying asleep. This is going to measure your cortisol levels. The other thing we're going to test for autoimmune disorders. We talked about Hashimoto's. Hashimoto's is an autoimmune disorder that affects and attacks the system. We'll want to be able to see if there's anything else going on in your system. We're going to test, as we go through, and we're going to test those thyroid panels. We're going to test for the different antigens. We're going to see if maybe one is greater than the other. Those things need to be in balance, and if they're not, we can have the Hashimoto's disorder. We're going to do immune panels. We're going to see where the lymphocytes are. We're going to test the killer cell activity and all the interleukin activities. And that's going to tell me exactly what's going on with your immune system. The first thing we have to address in anything is an autoimmune disorder. That trumps everything. We can also run a test to test for leaky gut syndrome, and that's with the H. pylori. A lot of times when we eat processed foods, things like that, we're going to see that. We're going to do an intestinal permeability to see if our foodstuffs are leaking into the intestines and we're not being able to absorb what we need to. The other thing we're going to do is we're going to do a neurological exam. We're going to test you. We're going to test your eyes. We're going to see if your brain is functioning the way it should. Anytime we have deficits, that brain is not allowing full function of the entire body. So we have ways that we can go in and figure out if it's excessively firing, if it's not firing enough. And we'll be able to do that. The way we treat, we'll also be able to do, we'll do hormone panels. There's a lot of people, a lot of women especially, who are on hormone replacement therapies. We need to make sure that those hormone replacement therapies are actually what you need, or if we can take that and do some other nutrition and find out if that's actually what's harming you, figure that out. A lot of times we're going to test for inflammation. We're going to use that C-reactive protein, test and see if what its levels are. A lot of people who have fibromyalgia, that C-reactive protein is at a very high level. And all of these levels that we're going to test, we're going to do that on a functional level, not just on a standard level. Standards are based on everyone in the area, and if everyone in your area is sick, then all those levels are going to be a very, very broad spectrum. We're going to narrow it down and we're going to catch functional levels. We use glutathione in the majority of all of our treatments. Glutathione is the mother lode of antioxidants. You've heard of free radicals? Free radicals are that electron that jumps out and it attaches. And that's how we can build cancers, things like that. So we want to close down that glutathione. A couple of the things that we're going to do is we're going to use enhanced air. How do you think that the brain functions? And how do you think that the body heals? We need glucose and we need oxygen. So, the way we're going to do things is we're going to use enhanced air. We're going to increase that oxygen flow to the brain. One of the other tests we're going to find out, we're going to do a fasting test to see what your glucose levels are, to see if you have excessive amounts, see if you're insulin resistant. The greatest thing we're going to do also is the brain-based therapies. Since the brain runs the entire system, if an organ or a system has been shut down for a long time, that signal has not been going to the brain like it should, and vice versa. Therefore, part of that brain has shut down, and we need to figure out which part, resume its firing, and get everything back into balance. It's all about balance. We want to have the right hemisphere working with the left hemisphere. We want to have the cerebellum working like it should, keeping your balance, keeping you going. The other thing we're going to do, it's kind of a little bit of a revolutionary thing. We're going to do interactive metronome. It's a computer program. You can Google it if you'd like. It's interactivemetronome.com. What that does is that's going to integrate and get that brain working together with the other one. So these are some of the things that we do differently, and we figure out, we leave no stone left unturned. We figure out just what is going on with you by running these tests, doing a neurological exam. Anytime we find a positive, we go down the road, and then we go ahead and we do another test to see if we're on the right track. Let me ask you a few questions. First of all, how has your health condition affected your job, your relationships, finances, your family, or any other activities? What has it cost you in money, happiness, sleep? Do you suffer from that insomnia? And another really important question is, where do you picture yourself in the next 1 to 3 years if you don't take care of this condition right now? And what is it worth to you if we could improve your condition? Here's what to do next. You can either call our office, 308-532-0234, or you can go here on the website, you can fill out your information, and we will send you a free report on the thyroid. We can send you a free report on just about any chronic condition that you have. We work with peripheral neuropathies, we work with diabetes, we work with a multitude of conditions. Right now we're focusing on the thyroid because we have found, especially here in the Midwest, that the thyroid affects everything. It regulates the entire body. So I look forward to hearing from you. I look forward to helping you. Thank you.